Hello, everyone. Welcome to the webinar on COVID-19 reporting today. My name is Raymond Lee, and I'm the Associate Professor of Practice at Department of Journalism, and also the Director of Institute for Journalism and Society of Hong Kong Baptist University. So I'll be moderating today's webinar. More than 3 months ago, the outbreak of a new coronavirus, now officially named COVID-19 by the WHO, started in the city of Wuhan in China. Since then, it has been developed into unprecedented global pandemic. According to the latest figures, more than 1.6 million people around the world have been infected with the diseases, and nearly 100,000 of them have very sadly lost their life. The unprecedented global pandemic has also posed huge challenges to the journalists who are covering arguably the most important news stories of their career so far. So how are they coping with the challenges? How are they trying to get their news stories out under sometimes life-threatening situation? And how are they fighting off rumors and speculation to ensure their news stories true and accurate? So on that note, we are very honored today to have 3 distinguished journalists joining us to share their own stories with us. So the first one is Mr. Ben C. Solomon. He's a filmmaker-in-residence with Frontline PBS in the USA. And he was formerly a multimedia correspondent with the New York Times, where he was a part of the reporting team, won a Pulitzer Prize in 2015 for covering the Ebola crisis in West Africa. So thank you very much for joining us from New York, Ben. So,
thank
you. Okay. And the second guest speaker is not that far away. Actually, he is Mr. An Ran, the chief editor of China Newsweek, based in Beijing. He was a Nieman Fellow and a Bill Melinda Gates Foundation Global Health Reporting Fellow. It's also worth mentioning that before becoming a journalist, Mr. An Ran had 10 years of clinical medicine and scientific research experiences. Last but not the least, we have Elizabeth Cheung, a health affairs reporter with the South China Morning Post in Hong Kong. She's been covering COVID-19 outbreak in Hong Kong virtually on a daily basis. So welcome you all again. Today's webinar will be divided into 3 parts. So firstly, 3 guest speakers will take their turn to speak about 10 minutes each. And after then, there will be a 30-minute discussion session in which my colleague, Rosemary Cheung, assistant professor with the HKBU's Department of Journalism, will be joining me to have a dialogue with the guest speakers. And after then, you guys will also have the opportunities to ask them questions. Another colleague, Robin Yeung, will take part of or take care of that Q&A session. So let me now invite Ben C. Solomon from New York to start his talk first. Over to you, Ben.
Hi, thanks for having me, and thanks for everyone for tuning in today. It's very nice to be here, and it's nice to speak to you all. I wish that we could do it in person. My name is Ben C. Solomon. I spent the past 9 years as a video journalist and a multimedia correspondent, which means I just worked in many different fields. I wrote, I did videos, I took photos, but mostly I did like short form films. As Raymond nicely said, a big part of that was some health coverage that we did in West Africa during the Ebola outbreak in 2014. And that was kind of my first foray into health reporting and into outbreaks of any kind. And what it taught me and what I learned from it was just a lot about how these things spread and how people and lack of education and lack of resources kind of play a big role in how they kind of spread even further. So in 2014, the Ebola outbreak was a really interesting signifier for me, but what was really different about it from now was that it was much easier to manage, especially for a foreign correspondent like myself, and much easier to cover because there was a lot, the way that it was spreading was a lot more obvious, and it was a lot more controllable. So the rules of it and the realities of covering it were that if any of somebody else's spit, blood, mucus gets inside your mucous membranes, then you would be infected, and then you would not be contagious until you started showing symptoms yourself. So in a way, you were never going to be a risk to the others around you until you started showing symptoms. With COVID-19, it's so much more complicated and so much more harsh on its spread, because you can easily get it, you can easily spread it while asymptomatic in the first few days. So really, it's such a different disease and such a different kind of progression of an outbreak. So for me, I've been finding it very difficult to cover it and trying to find interesting ways that are also safe. The most challenging thing now is that anytime you are filming, anytime you are interviewing, anytime you're putting yourself outside of your home, you're ultimately taking a big risk, not just to you, but to other people around you. So you really kind of need to manage how much you go out and manage how much you interact. And it's been very hard. I think for so much of my career, I've spent a lot of time in conflict zones and wars. I've covered not only the 2014 epidemic in West Africa, but then last year, the 2019 Ebola spread in Eastern Congo. And so much of that was about trying to protect yourself. And now the real implications of spreading it to others and spreading it to people around you that you care about, or people that you're working with and covering, is quite a challenge. So far, I have spent the past, I just returned to New York after a month in Ohio, where we were doing a film about homeless shelters and the homeless community. And the way that we were trying to film that was as safely as possible to try to follow one family who was homeless. And in America, as with most of the world, so much of the response has been to stay home, to isolate yourself, and to socially distance yourself from others. But for the homeless here in America, there hasn't been much thought put into how they might respond. So a big part of our film was to try and show from a very personal perspective how one American homeless family is able to distance themselves. And this is one of the many important and challenging stories of this time. The challenge for me was, how do I separate myself from them in a safe way? How do I make sure I don't expose myself? How do I make sure that they aren't exposed and I could be kind of walking in? So a big part of what we were trying to do is just to tell the stories of these people and try to do it from 6 feet or 1 meter, and try to do it as kind of quickly and kind of concisely as possible. So that was kind of the first story that I've been working on in the past 3 weeks, because here in America, of course, it hasn't been as prevalent, or it hasn't been as spreading until the past month, unlike there in Hong Kong. So what's happening here in America now is so dire and so intense that it's kind of hard to figure out which stories to choose. There's so much to do, and there's so many stories that are happening each day. As a video journalist and as a filmmaker now, it's much harder to figure out what the stories are going to be and how to develop them now, so that later they might serve an important purpose and help people kind of understand something more intimately. But I think that as Raymond said, this is going to be the biggest story of many of our lives. This is probably the biggest story for Americans since World War II. And I think it will shift the dynamics of our lives and probably people's lives all around the world in ways that we could have never anticipated. So it's an important story, and it's a complicated story, and it's international, but it's also something that we have to really take care so that we can keep covering it and not be sick and be part of the story ourselves. Yeah, how am I doing on time?
You got another 2 or 3 minutes to speak if you want.
Well, let me hand that over to somebody else who maybe knows more than I.
Okay, thank you so much, Ben. And
thank you.
Yeah, okay, let's move on to the second guest speaker, Anran from Beijing, to share his story now.
Hello, everyone. Yeah, good to be with you. Yeah, my name is Anran. Yeah, I'm from China Newsweek. Yeah, so I think I have to introduce our magazine, the news media, for everyone. This would be helpful for you to understand accurately our reporting. Yeah. The magazine in China Newsweek is not one of the most influential news magazine in mainland China. It is owned or sponsored by China News Service, so weekly news magazine. So if you want to understand the reporting, I think you should understand the background of different media in China. So I can say, so there is a spectrum of media platform in China. So the end is the state-owned media, and the other is the market-driven media. So it is the spectrum. So our magazine is, I think it's just located in the middle of the spectrum. So we are a mixture of market-driven and the state-owned propaganda system. So accordingly, so the end is the professional journalism, and the other end is the propaganda. So we are just located in the middle of the spectrum. So I think it is both advantage or disadvantage for us to reporting the news story. Yeah. And this is explain the background of or the nature of our news magazine. Yeah. The other, I want to talk about the team. So for the coronavirus epidemic reporting, yeah, we built a team specialized in reporting the epidemic at the very early stage of the epidemic. So our first reporting from Wuhan is on December 30th. On December 30th, we sent a reporter to Wuhan. When I hear about there's several cases of the unidentified pneumonia cases, so I sent a reporter to Wuhan. She got to Wuhan and make 3 news stories, but actually she find I as a medical doctor, I was a medical doctor, so actually I can say I underestimated the scale of the epidemic. So there's only 3 very simple news story when my first reporter went to Wuhan. So this is the first stage for the reporting. So I underestimate the scale of the epidemic because I understanding the SARS lessons in China. We already have a good public health system, CDC system. So we technically have advanced scientific technologies to trace in molecular medical level to trace the viruses. So I think technically, we can, technically or in scientific technique, we can trace the virus accurately, more accurately than 17 years ago. So the system of Chinese CDC system should be much better than that time. So my judge, I think, underestimate the epidemic. So I was not able to imagine in the early stage. I was not able to imagine how pandemic it would be at that time. So as a medical doctor, So after my first reporter met 3 news, she came back to Beijing. So because it is very close to Spring Festival vacation. So the reporters are on the vacation at the second stage when the official sources told the public, the pneumonia can transmit it person to person. So things got serious, I think. So I called my supervisor at that time on January 20. So I want to resend reporters to Wuhan because things are very serious. So it is very close to Chinese New Year Eve. So we sent the second reporter to Wuhan at the Chinese New Year Eve. It stands for the second stage of our reporting. So although we are a weekly magazine, we have a new media platform. It is very influential. The new media platform of China Newsweek include WeChat, Weixin, WeChat, and Weibo, and some other public third-party platforms. So we altogether there are 70 million followers of the new media platform of China Newsweek. So we do the story both for the new media and for the print magazine weekly. From now on, we published 10 issues of the magazine, 10 issues. Each issue, the cover story of each issue is on the coronavirus pandemic, and we published 3 to 4 stories every day on our new media platform. The team of the reporting the pandemic is majorly consisted of our science and technology sections. The magazine, the team of the magazine has 6 sections. So the reporters are majorly from the science and the technology section. 12 to 15 reporters and editors involved in the reporting. I think it's a very historic story. For my lifetime, I think I cannot imagine there's a news bigger than this one. And it's also very, very competitive for journalism. It's very, very competitive. So the reporters and editors are very exhausted and also excited to join this job. There are still 4 reporters in Wuhan right now. They cannot retreat from Wuhan to Beijing because there's a regulation, you know. They have to stay in Wuhan. Maybe there is few story, you know, in Wuhan right now, but they have to stay there for another 2 weeks, I think, you know. So I hear the news that they are for another 2 weeks. Yeah. So it's
Okay.
a group is a very, very competitive. Yeah. Okay.
Okay, thank you very much, Anran, for sharing your story. So now we come back to Hong
you.
Kong, and let's hear what Elizabeth Cheung from SMP would like to share with us.
So, thank you very much for giving me this opportunity to share my work at the South China Morning Post. So I work for the city desk. So my main job is cover the daily news on COVID-19 in Hong Kong, and also need to pick out news story topics that would be suitable for maybe used for like advanced news stories. So maybe I could give a brief idea on usually what's my routines like on a regular day when there aren't any like suddenly big policy announcements happening. So usually I will start my day, you know, like reading news stories of local and sometimes overseas media to have the latest grabs on what is actually happening in Hong Kong and also around the world, given this epidemic is not only on a local level, but also on an international level as well. And then after that, we usually have a routine discussion with my supervising editor on what we should follow up that day, what story angles we should pursue that day. That might be based on some sort of new measures from the government on the previous day or some special cases that might worth following up. So, and after that, we need to start preparing for the 4:30 p.m. press conference by the Center for Health Protection and the Hospital Authority. I think the preparation is quite important because that 4:30 p.m. press conference is the only time for us journalists to really ask questions directly to officials, to really confront them if we have any follow-up on the COVID-19. So during that day, first of all, I need to monitor what is actually happening on social media, on the government information system, and also on other media outlets as well. And also at the same time, we need to if there are anything that was mentioned in the morning radio phone-in programs, might need to call a bit more people in the medical sector for follow-ups and to ask a bit more, maybe to beef up stories. And well, during the 4 p.m. Press conference for us in our newsroom is usually handled by 2 people. So first we have one in the office, or for now is at home, another one at the scene asking questions. And then the pace is really fast because we are a daily newspaper and we have to update our website 24/7. So maybe just after the press conference has gone on like for 5 to 10 minutes, then quickly we have to file a quick update for our website. And then afterwards, after the press conference and in the next few hours, usually it would be me and another colleague working hard to file a more complete news story. Maybe that would involve a few more phone calls, calling people. And then actually after filing a story, there will actually be still more updates, maybe from the government, from the hospital authority. So usually a normal workday is quite long. The time I could really call the end of my day usually be around 11 p.m. or maybe later. So that's the routine of my regular day. So actually for covering this COVID-19 epidemic, there are quite a few challenges. I would say, first of all, in terms of information, I mean, there are like more efforts and time you needed to verify the overwhelming load of information coming in. So, I mean, in the initial stage, maybe for you who are in Hong Kong, you might often notice that there are news stories popping up saying that, oh, we have this amount of preliminary positive cases in maybe in Eastern Hospital, in Queen Mary Hospital. This is not official information, and it often involves a lot of efforts, calling in hospital insiders, the sources in public hospitals to verify whether it is true or not, because sometimes turn out it might not be true. So that's it. And I mean, the government updates on those cases, usually they will just update in the 4 p.m. press conference, and later on in the evening, they will have another press release on that. But I mean, the updates actually, when you see the news reports, is all throughout the day. And then also as well on social media, sometimes they are quite, I'm not sure you might be aware there's a Facebook page called HA Secrets. That's actually one of the sources for us to look for stories, because quite a lot of hospital workers, they would maybe make their complaints about how the system is not working. But sometimes, I mean, those complaints that might look juicy as a news story, but often you need to do verification yourself whether they are sound and whether they are really a newsworthy story. And then that's why often you often need to make calls, to make more phone calls to maybe to doctors, to people who are really inside the system, to ask if this is really the problem. I mean, one example is, I mean, a few days ago, I came across a post, my editor asked me to follow up on like a doctor in the dirty team saying that, oh, we have lots of patients returning from overseas, like they refuse treatments. That's an issue. Maybe we should follow up on that. So, and that doctor in that post saying that, well, this group of patients, they're bringing a lot of troubles. But when I call more doctors to ask, is this really an issue? It turned out that actually it might be not, because the drugs, the medications we have for COVID-19 now, they're all experimental. So, I mean, patients, they do have rights to refuse treatment. And indeed, quite a lot of patients, if they're young and fit, actually they do not need treatments. So these are the efforts we need. And also, I have been covering healthcare for 10 years time already, but then in COVID-19, there's lots of scientific jargons that, for me, who do not have real scientific background. So, there's a lot of efforts to really understand what are those terminologies about. For example, what exactly is PCR? So what exactly is serological test? And what is antibodies? So what are all this means? For me, it's always an effort, often have to ask doctors or scientists to explain to me, so how do I translate all these terms into layman language? Because our newspaper is not a scientific publication. We are mass media, we're for layman readers. So that's one thing. And also, and go back to verification. And also, I mean, throughout the epidemic, you'll notice that there are quite a lot of confusing information. For example, when we come across on the use of masks, maybe in the Western world, they would say that, okay, maybe in WHO, I mean, they have just recently kind of shifted the stances a bit, but then, I mean, in Hong Kong, we have been told by experts that, oh, masks are useful, but then in the Western world, maybe even the WHO also said that only people with symptoms, or only if you take care of COVID-19 patients, you will need masks. So these are all those debates that come across, and for us in journalists, I mean, we're not here to judge, but then we have to really bring in the discussion, bring in views of different experts to let readers know the views, and also maybe whether we can reuse masks or not. I mean, previously we come across some people saying that maybe you can steam your mask. And for us, I mean, it's really so important. I mean, apart from, following, chasing up all those cases like hamster on a wheel, we also have to, debug all those maybe confusing information. So it's really quite challenging. And therefore, I would say, go back to the point I previously mentioned, the working hours every day is really long. So sometimes it could be 12 hours or sometimes even longer. Because for us, this epidemic is not only something about Hong Kong, it's also about international level. So what is happening outside Hong Kong could also affect us as well. So, for example, after a whole day of work, maybe in the morning when I wake up again, we need to take a look on what is happening from the WHO side, or maybe in Europe or in America. So it's really, I would say, it's pretty exhausting, especially in last year. In the second half of last year, we had the anti-government protest. It was actually quite an exhaustion to our newsroom because we have been intensely going out, covering out the protests. And then right after that, we have this epidemic. Well, at this moment, we still see no end of sight. So yeah, I would say it's really a test of endurance and patience. But for me as a journalist, it's also a privilege that we could witness this big history at a time and to tell the story of Hong Kong to the world. Yeah, that's it.
Okay, thank you very much, Elizabeth. And now let's move on to the second part of the webinar. So let me introduce our colleague, Rose Cheung. And so she will be actually join us now and then, have a dialogue with the guest speakers. So maybe let me ask the first question to Ben first, and then Cheung could ask other questions. You mentioned about actually you went to Ohio and to report on the people in family shelter, how they are coping with the situation. I just wonder, that could be a very emotional situation, and because I think a lot of them were in very desperate situation. So how did you actually try to control your personal emotion when you saw the situation over there, and then try to get the story out and then share with your audience?
Yeah. Yeah. In terms of controlling my own emotion, for me, what is most important is the story of these people. And I think that, in any situations, when I'm working in situations that are complex emotional situations and very harsh times, for me, I always try to leave my emotions out of it. It's obviously challenging to watch people in such desperate times be pushed aside. But I think more importantly, and more, I guess, what gives me the comfort, or what gives me the kind of ability to keep doing it, is knowing that my story could help, my work could kind of help push them through it. Hopefully. I think that in America right now, there's so much rough news. I really sympathize with Elizabeth. It must have been unbelievably exhausting to cover the protests and experience that for the past few months, and then jump right into this story, which is even more challenging and more kind of complicated. I can't imagine the pace of that. So for me, I feel almost like I can't imagine having to come into it with that much exhaustion. It would have been a much more complicated situation. Yeah, for me, it's always a matter of kind of separating yourself from the story and just kind of focusing on the work and focusing on how the work might eventually help these people and might eventually kind of spread the message and the understanding. And that's what helps me to kind of push through it.
Okay, over to you, Rose.
Okay, thank you. Thank you, Sri, for joining us. So I just want to propose my question to three of the speakers altogether. So for Ben, just like a follow-up, I do understand you said like you feel you had a lot of pressure when you covering the story because you need to protect yourself. At the same time, you need to protect other people. So it's just the same feeling when I was cover SARS 17 years ago. So I just have two questions for you. One is you talk about to cover the homeless people. So a lot of the time we're talking about news angle. So what are the newsworthy topics for the journalists to cover? So why do you think those underprivileged people are so important for the audiences? Yeah. And the other is before you cover Ebola, so that's the international news. Usually for the American audiences, it would be less controversial. I mean, if you cover like a domestic news, there's a lot of issue might be causing a lot of controversial. Or so what are the differences and how do you cope with that? Or what's your news framing on international news writing and local domestic news writing? And for Anran, yeah, finally meet you here. New person. Yeah, I have two questions for you. One is you mentioned I read one of the story, interview your associate editor. She said you have a separate focus on medical experts because they're in different fields. Why to ask the journalists understand that the different field of the medical experts is so important. And the second one is on February 17th, your magazine published the story on infected medical workers. So I think this is a very, very important issue and also very sensitive issue in China because I just analyzed more than 3,000 news articles published for the last 2 months. Very, very few mentioned about the infected medical workers, and it's still very sensitive issue now. So why you decided to cover that story? What are the consequences? Any pressure from the censors? Sorry for that. You can answer that or not. Okay, for Elizabeth, you mentioned because in Hong Kong it's relatively have more access to the official data. So for covering daily press conference, how to prepare to figure out, because sometimes government might provide inaccurate information and sometimes incomplete information. So being a journalist have this opportunity to sit in front of the official and raise the question, how to grasp this opportunity to just point out the loophole of the officials. Yeah, thank you. Ben, you go first.
Oh, I go first. Okay. So my two questions, if I understand correctly, were why the homeless community as a focus, and then how is internationally the story of Ebola different from this one? So for the first one, for the first question, why the homeless is a focus? I think as the virus is spreading here in America, what's becoming very clear and very important within our structure here is that our healthcare system here in America has been failing immensely. And it's been failing now in a more obvious way, the people that are in the more underserved communities, in the lower income communities. I think the idea behind following the homeless shelters was to understand the differences between the disparities between how the virus is affecting someone like me, someone like my family, someone like any of the upper class, more wealthy people in America versus some of the poorer people in America and who are being kind of left behind out of this. So I think as the virus, you know, in America right now, it's a very challenging time where we're kind of seeing a lot of the seams of a lot of our kind of discrepancies between different classes and different races. And I think a lot of people have a lot of questions about where that leads. And especially now with this virus spreading so rapidly, it's really obvious that some people are better suited to defend themselves against it, and some people aren't. And I think that for my challenge was to find the stories that are going to be less covered and less kind of obvious, and that is to show the most at risk and the most underserved. In my story, we follow a woman who has a severe asthma, and she still has to work a night shift at McDonald's so that she can make minimum wage so that she can get out of homelessness. And she can't make the money that she needs to get the apartment that she wants because she is getting her hours cut. The place where she's working isn't hiring her as much, and little by little she's just getting less and less. I think these stories are really interesting and really important in these times, and I think that my contribution as a filmmaker should be to try to kind of highlight these stories and try to invest with these families to watch them firsthand and just understand their lives and their stories as it progresses. So that's question one. You want me to do the second question, or do you want to talk with somebody else first? Keep going. Okay. So the second question was after the Ebola outbreak, how internationally was how is covering an international story different? It's a very good question. I think that when I covered the Ebola outbreak, it was, for a long time, it was the threat of its spread in America that gave readers, that made it interesting and relevant and powerful to so many readers and viewers in America. Now, of course, it's extremely relevant, not only to people in America, but people all over the world. I mean, I don't think there's many places that are not affected by this virus. So I think that what's different, especially now, is that, everyone is involved in some way or another. It's kind of hard to, you asked, why did we pick to focus on the homeless? I mean, we could have picked so many other things. It's hard to pick which one is the most affecting and important. So with this, it's just so much more widespread. It's so much more prevalent. It's so much more kind of all over. And I think everybody has their stories. What's interesting to me, and what's interesting of what I've noticed, is that, so much of my work has been traveling internationally and going to other countries and reporting on stories there for an American audience primarily. Now, I think that if there's any upside to this virus, it's that so many local, because people can't travel, just traveling has been so limited. So many local reporters are telling their own stories. So many people in their own countries are reporting, not only the New York Times, but so many international outlets. And I think that's really a defining moment for so many of these industries, because for so long, the West has, or at least the West has, depended on this idea that they have to send their own people to tell their stories. And now I think everybody in their own countries are telling their stories phenomenally. And the journalism is being really reinforcing the fact that so many journalists in these places that I have traveled to are very capable at telling their own stories, and very powerfully and importantly too. So if there's any good that came out of this virus so far, it's that.
Okay, thank you, Ben. So Aaron. Hello?
Your first question is about the knowledge of medicine, how play the role of the medical knowledge in the reporting the stories about the coronavirus. So first, our team is very young, very well educated, and most of them are young reporters, experiences to study overseas. They have skills to learn new knowledges. They are very well educated. So I think the nature of doing journalism is very important. Is the process of learning or research. As I always tell them, if you're doing a story, you are actually doing a research on a specific topic. So learning ability is very, very important for reporters. It's very challenging and also very interesting for every individual reporters. So the medical knowledge is, I'm surprised the public, not only the reporters, the public are so interested, are so attracted by the medical knowledge in the process of the pandemic. The herd immunity is very, it's a term, it's a medical term, but almost everyone are very familiar about the terms like this concept, So they are very well educated, and we emphasize the ability to learning, even do research on the topic. So actually, I am a reporter with the medical background, so I can help them to make the final decisions. So that when I edit, so I can correct the some mistake on us. In advance, I can tell them how the story, how we can call the knowledge point in the story should have. So it's very, I'm a support system, I'm a supportive, for them. So it's the other is the knowledge, the medical knowledge is very practical in the process of epidemic, and is very practical and very targeted. So the learning, there's a internal drive for them, for the public and also the reporters to learn new knowledge, medical knowledge. So, I'm very surprised for them. So my major player for the major member of this reporting team is editor only with the journalism education background, but she is a very, she did many medical stories for our magazine's cover story for many years. So she already accumulated kinds of systematic knowledge of medicine. So it's a very important role as the editor of this reporting, So I am the final decision maker, maybe, So the first question. The second one is about a specific story about the infected medical staff in the Central Hospital of Wuhan. You mean this story? This is a very important, and we are the first media to do the story about Eifeng. Eifeng is the doctor, of the emergency department of the Wuhan Central Hospital. So we are the first media to do that. It is a little bit hard for us to decide which story is fine for us. We can't do that. I think different factors involved. The first is speed. Speed is very important. So we find the important question, important topic, important person, what to be reported. So the speed is very important because we are the first one. So if you are the second one, the third one, you are okay. If we are the fifth one, you are not okay to do the same thing, So speed is very important, the first one. The other, I think the other factor is professional. So if you explain, if you tell the story, if you explain some problems in a very professional way, you are you are away from some other society, social or political factors, because you are very professional in both journalism and medicine. You should be the more professional, the more safer, I think, So the first, the second factor is profession, And the third is the flexibility, We have some, red lines. We have some limit to do something. If you are very, very familiar with you play with the system, you are very familiar with where is the red line, where it is. So you still have your space to do something. So, this is my answer.
Can I just follow up, because you mentioned Eifeng. Another story, the same story, another story about the Eifeng was conducted by Renwu, another magazine. the story was deleted, right? And it's also causing a online phenomena, because people are using different forms to copy or paste the same article by using different languages, even the language I don't know. So why you think your story, you're talking about the same issue, as same person, but why story was killed and the others are still alive?
Which story is killed? Yeah, the story from Renwu was finally killed. Yeah, but it was killed after several days. You know, it spread everywhere, and with different languages, it's it's a very good contribute. It's spread everywhere, so it's killed because I don't think someone observe. Yeah, I think someone observe which story is very, very negatively influence the public. So they call the man negatively influenced. It's very strongly negatively, influence the public. So they kill it, maybe, Our story, it's a feature story. It's a feature story from Renwu, So it's very, very influential, And maybe there's some other reason. I cannot know why it is so explosive story. We do the same story, but the story is more, we are very, very reasonable. We control ourselves, we control ourselves. We keep in a proper tone, to tell the story. It's a kind of investigative story, not a feature story. Very, very sensational, very, very emotional, It's reasonable, it's investigative, so maybe it's safer than a feature story, non-fiction, the different style, maybe.
Okay, thank you, Ran. And then Liz?
Thank you.
Yes, so you asked about how to prepare for to grasp the opportunity to ask officials if there's any inaccurate or incomplete information. And I would say that preparation is really important. And for me, it really goes back to the golden principle of you have to really read a lot. And that's why for me, reading news stories from local and overseas media is so important, because that really gives me the foundation on what are the missing pictures, what are the missing information or inaccurate information, maybe from the authorities. So with all this information on hand, then we just ask directly in the press conference. But sometimes it might be out of the scope of that official. Maybe the official might not be able to answer as well. So for me, I might have two ways to handle. So if that official in the press conference is going to answer me, then afterwards I may make a few more phone calls to the sources I know inside the public hospitals, or maybe inside the authorities, to ask them if they have a bit more insiders information. But if this way does not work, then I would just state it as a fact in the news story, saying that maybe this this information could not be provided. Or maybe if there are like conflicting versions of answers from different sources, then maybe I'll just put it in the story as well, and just let readers to understand maybe we have this like different interpretation or different versions of information. I mean, for us journalists, it's not for us to decide or to judge which one is right or wrong. We're here, to let our readers know what we know from our sources. So that's actually quite a limit. There isn't a lot that you can do when handling this kind of situation.
So a little bit follow up. So sometimes maybe the next day, your sources will give you opposite information to correct the previous one. So when you're writing the follow-up stories, how to make sure the audience will not be confused, because they will feed up like,
Yeah, that's why it's so important to state in our following follow-up story that, oh, maybe we said, oh, well, it was previously reported in this way, like fresh information showed that it should be blah, 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 something like that. So one example would be, so today is Friday. So on Wednesday night, it was emerged that a Cheung hospital occupational therapist was tested weak positive to the virus. That was actually quite important because a hospital infection of a hospital worker could indicate a bigger picture. So it could be, would it be like a hospital outbreak? Would it be an outbreak among patients? But then like that information was released by the hospital authority. And then later on in the press conference yesterday, the Department of Health said that actually that staff was tested negative. So for us, we just stated here, like, so this staff who was reported as weak positive to the virus on Wednesday night turned out to be negative. So in this case, we'll let readers to have like a really clear picture, clear graphs of how the information evolved in time.
Mm-hmm. So thank you all. Raymond, I think it should be time for open to the floor.
Okay, yeah, thank you. Thank you, Rose and the panelists. Now, let's hand over to Robin for the Q&A part.
Hi, everyone. So I'm going to moderate the questions. There's two channels to ask a question. One is you can go into your toolbar. There's a little button that says Q&A, and you can post a question there. The other option is in the participant box. There's an option to raise your hand, and I'll see a little blue hand, and I can unmute you, and you can ask your question verbally. I'm afraid we're not going to have time for everyone's questions, so if we don't get to yours, I apologize, but we will have a recording of this available when it's all over. So please raise your hands if you have a question, and to start with, quite a few of you guys have already posted in the Q&A. Some of them have already kind of been answered in the discussion. But I thought there was a nice one from Jan. She had a question for Elizabeth. And she wanted to know about how journalists are covering the domestic helpers in Hong Kong. But I also think this could go to everyone. And the question is, to what extent, you know, how do you have an inclusive public health journalism? So maybe Liz, we can start with you, and then maybe Ben or Anran wants to jump in.
So, you know, because this epidemic involves so many perspectives, I mean, I have to be really candid and honest here. I haven't covered much on this side on domestic helpers when it comes to COVID-19 in Hong Kong. I know that some of my colleagues who were in the like more labor and welfare side, they did cover stories on that. But yeah, and so therefore I would say that this whole epidemic is not only involving the health beats, but also like involve reporters of different beats to cover areas that were related on this side. But I mean, I could still share a little bit past experience on covering domestic helpers. I mean, it would always be good if we want to approach them. I mean, there's a few ways. There are a few organizations that are actually representing migrant helpers, migrant workers in Hong Kong. So that's a way to approach them to see the big picture of what is the representing voices. And another way is really go to the field, like maybe on Sunday, go to Wan Chai, go to Causeway Bay, go to Central. I mean, before the gathering ban came into effect. I mean, when they're, and to really talk to those people to understand actually how this whole epidemic has affected them. And also another side would be talking to employers, representatives for the foreign maids. So that's a few way to do, but I have to be candid here that I don't have much experience when it came to COVID-19 for the foreign maids. So sorry about that. Don't have a lot of useful information to share.
Yeah.
Ben, I think you're also doing a lot of inclusive coverage with your work, and maybe you have something you can add to that comment.
Can you repeat the question again?
Well, the question was to Elizabeth specifically about covering domestic helpers in Hong Kong, but also the general question of how do you be inclusive when you're reporting on public health?
Yeah, I think it's especially here in America, it's really, as I was saying before, like it's an important part of our coverage and how we're kind of seeing the stats. I mean, right now the statistics for African Americans are a lot higher for both infection and death rate. Well, don't quote me on that. I know it's a lot higher for death rate. I don't know about infection. So I think a lot of people are trying to understand, because America is such a diverse country, how the virus is affecting many different populations and many different communities. For me, you know, I just did this story about an African-American family in Ohio, trying to understand how the underprivileged are getting affected. And then the next story that I'm focusing on is going to be about immigration detainees, basically people that were detained by the immigration policing force here known as ICE, and how those facilities are at risk and how they are treating these immigration detainees who are awaiting repatriation. Because the problem is, you know, we have these people sitting in cells who are being deported back to their own countries, but how do you deport people back to their own countries now? So there's no good options for these detainees. So yeah, I think, you know, especially in America, because there's so much diversity and there's so much kind of different statistics for different communities, it's really important to kind of see the different communities and try to spread the coverage out amongst that.
Great, okay. We have a good question from Aditya in India, who is asking, what do you do if the government is not giving perfect data? As there are many allegations from China and a few other countries in the world, they have not disclosed actual data. How do you handle that as a reporter? And then also, what precautions would you take when quoting scientific papers that have not yet been peer reviewed, because COVID-19 dynamics are changing very rapidly? So I'll open that to whoever would like to answer. Let's see. So lost some. So maybe I think maybe for Ran, that question really affects you. You know, what do you do when you're not sure if you're getting the right data from the government?
Yeah, this time, because it is also a competition from the science community. You know, the science community is very competitive to publish scholar articles. You know, academic articles. You know, it's very competitive. It's an advantage for us to do our reporting. You know, because the scientists, because it's very emergency. You know, urgent. It's an urgent thing for them. It's very, very speedy to publish their result, to do the research, some very small and individual research. So because scientists in China, they want to have the highest score index, you know, when they publish the academic articles. So it's an advantage for this time. So maybe we cannot in time, we cannot timely to collect the data from the official side, the government side, but we can interview with the specific authors. You know, they are researchers and scientists to have data, and then we have the opportunity to understand what they told the public. And then we come back to the government to tell them, to the officials, we have already know something about the data from the science community. And please tell me the other side of the data and please explain something. So it's an opportunity for us, you know. This is a little bit special experience for this reporting reporting on coronavirus epidemic, I think so, yeah.
Great. Okay, it looks like we have another question from one of our students, Malik. He's one of our journalism students. He has a question for Elizabeth, but I think also anyone could jump in and answer this. It says, the WHO in Taiwan, his subject, the WHO Secretary General has recently shared that he has been subjected to death threats and even racially derogative comments such as Negro, which perhaps if true is problematic. What's your take on the insinuation that WHO is under pressure from China? And why are WHO officials seemingly avoiding questions regarding Taiwan in this global pandemic?
Well, I would say maybe this question would be best answered by WHO itself, but I mean, again, for me, me as a journalist, I'm not here as a position to judge, but I would say it's quite frustrating to see how slowly WHO has been responding throughout this epidemic. I mean, if we go back a bit earlier, we see that, well, the virus has been spread quite a wide scale already. At that time, when everyone's think that it was already like a public health emergency, still the WHO hasn't done anything until it was quite serious. So why the WHO has been avoiding, has been under pressure under China or avoiding the problem of Taiwan, I don't think I'm at the best position to make a comment on that, but I would say that what the WHO has been doing is really quite frustrating. And also when it comes to, that also kind of relates to a previous question on data, because for sometimes we want to do some sort of comparison of case data between countries or regions. If you just rely on one source, if you just look at WHO, it's actually quite difficult to find the data of Hong Kong or Taiwan separate from the Chinese data, the mainland Chinese data. So slightly go back, make an addition to the previous question as well. I would say that actually it would be good to go for multiple sources of information when you see that there might be an inaccurate data in one source. So for me, I mean, in Hong Kong, I would say that the case data, the number we have is pretty up to date. But for example, we want to look for data in mainland China or maybe in other countries, there are field sources like the Johns Hopkins University dashboard. That one is pretty good. And also for the data from the Oxford University as well. So I'm sorry that I'm not able to give a really good analysis on why the WHO has been often under pressure, appear to be under pressure of China or avoiding the issue related to Taiwan.
Yeah. Okay.
Yeah.
Looks like
I can talk a little bit.
Please go ahead.
If you, I think that the WHO. So I had a lot of experience with the WHO in both Ebola outbreaks in 2014 and in 2019. I think the WHO is, the health wing of the United Nations, which is historically, famously, infamously the most diplomatic, bureaucratic company or institution in the world. They live and die on bureaucracy, and they are born of diplomacy in so many countries. So the reality of the UN is that they always have to kind of play nice with everybody. They have to be everybody's friend, and they have to be accepted and friendly with everyone they can, which is hard. It's a complicated situation for so many of them, especially when they just want to fix health problems. But I do think that the WHO in this situation made a pretty bad miscalculation, which is they predicted, or they hoped maybe, that this was not going to spread the way it did. And I think that the idea behind making a really clear communication with mainland China was the hope of creating and establishing a relationship with the pure hopes of trying to stop this before it spread internationally. And when it started to spread, I think the idea was that they wanted to be able to control it within the borders of China, within the borders of a country that they could develop a relationship with. And the miscalculation was that they didn't understand how fast it would spread, and nobody did. And now, as it's everywhere in the world, and the WHO is not only fending off problems of its absence of mention of Taiwan, the complicating numbers with Hong Kong, but it's also now at the ire of the America's President Trump, and has become a welcoming blaming tool for so many of these political discussions, whatever they may be. And I think that is in part because the WHO miscalculated their ability to help the situation and to maintain diplomacy and bureaucratic relations with China, and then not understanding how quickly it would spread. So I think it started from the best of intention, which was the fastest way to help. But I think that I've spent a lot of time covering the WHO and a lot of time experience with them, and they are, if nothing else about them, they are very slow. And in this case, they were too slow.
Yeah, great. Okay, it looks like we have two good questions on social media. So Ira is asking about the dilemma, mostly in the mainland, where a lot of people are getting news from Weibo and WeChat, but the accuracy of that information cannot be guaranteed. She says, therefore, I think many people and news workers are facing great confusion when treating news in mainland China. And then we have another question from Rui, who is asking, what do you think is the role of social media in sharing your work to the public? Have you ever used it to communicate with the public about your work? So maybe, one side is more the bad side of social media, and one question is more addressing, how are you using it to reach your audience? So anyone who wants to jump in and answer that question may please go ahead. Or maybe, also Rose, I think you could probably weigh in with the fake news angle as well.
So I think Aaron can talk about that, because you guys are using a lot of social media, such as a WeChat public account to share your stories, right? And also at CMP, you also have like a Twitter account or Facebook account to share the stories. So I think a lot of experiences to share with. But I want to say, as in China, okay. Yeah, there is a lot of disinformation and misinformation on social media, Weibo and the WeChat account. So it would be very important for the consumers, the audiences, to distinguish the sources of the information, because a lot of misinformation are coming from so-called we media. So there's no official sources. You just don't know where the story came from. They so-called translated from the foreign media, but usually the translation was, you're always lost in the translation or misleaded by the translation. And also, I think for the audiences should be differentiate propaganda, because sometimes a lot of state media using social media to disseminate intentionally misleading information. So that is also a troubling phenomena in China. So for example, when we're talking about where the virus originated, so there's a debate, right? It originated in China, originated in the US. I think a lot of ordinary people in mainland China now do believe the virus originated from the US. So why they have this kind of thinking? And it's just because the information sources they can reach. So yeah. I think Liz and Ran, you can talk about your social media strategy to disseminate, to share your stories, because I think that will be the most important way, right?
Yeah,
I think it's.
Oh yeah, maybe Ran, you can go first.
Yeah, please. Yeah.
Okay, I'll go ahead. Yeah, it's actually quite common to see maybe sometimes your parents will send over this message, oh, maybe drinking warm water could help you prevent coronavirus, or maybe if you do some sort of exercise, then could help you. I think that often goes back to the golden rules of journalism is you really go for the real experts and to ask them, is this real or not? And I think this is what we journalists do every day. It's not only dealing with COVID-19, but also maybe in that also happened in the anti-government protests as well. During that time, there were quite a lot of misinformation, or sometimes appears to be real or not real information that were circulating in social media. And that makes journalism, news is so important, because for us, we have the channels, we have the access to the experts, and then we could really reach out to them and ask for the public or whether this piece of information is real, and then we could really clarify or maybe write a story on that to clarify whether, okay, this rumor on the internet, is this real or not. And then for the role of social media, actually that is something that has been and advocated in our newsroom as well. We are encouraged to use Twitter, to use Facebook to share our work, really to reach out to more audience. And sometimes in Twitter, since it is a public account, sometimes readers, they do leave messages and ask a bit more follow-up questions on, oh, how did you reach out to this story? How do you work on this angle? Or and also because in our news website, we also have email addresses of reporters who work on the story. So I have actually received quite a lot of emails as well from readers. So actually, these are the channels that we could really reach out to people and to really pass out the appropriate or proper information while there are like lots of confusions going around.
Yeah, I think social media is the active, very, very active social media environment in mainland China is very important for us to find valued news topic. We find the topic, we find some clues from social media. They are very active for us, but yeah, I increasingly feel the professional journalism is very, very important for us to clarify very large amount of information or disinformation from social media. So I feel the value of the professional news journalism's importance. On the other side, the public's journalistic journalistic literacy for the public has a very big space to be advanced and to be improved. So it's a very challenging question. So we can find some way to solve it very in a good way. Because the literacy of the public is another question. Yeah.
Excellent. Ben, is there anything you want to add about social media, or shall we move to the next question? Okay, well, we'll go on. So I'm going to go ahead and combine two questions again. We have a good question from someone named FL, who is asking Ran and Elizabeth what challenges they face in going beyond official sources to speak directly with patients and healthcare workers, given the tendency of authorities to discourage such access. And then someone named Tiffany has asked Ben specifically if quarantine is affecting his ability to report, and what is the biggest challenge for you when covering COVID-19 in the US? All right, so I don't know, Ben, would you like to start, and then we'll move back to Elizabeth and Ran?
Sure. The question was, how is quarantine affecting me? It's affecting a lot. I mean, I think that, like I was saying before, anytime that you leave the house right now, it's a risk. And I think that's like that in many places. So basically every time that I go out to report, we're trying to take a calculated risk. And it's tough, because I think that so much of the reporting that you want to do, especially to make documentary films, is just to spend time, is to create relationships and to experiment with finding different people and shooting different things and try to figure out what is useful to kind of build a story. When you're a reporter, you can do that on the phone. When you're a audio podcast producer, you can do that on FaceTime or WeChat, like you can record calls. But with filming and with photography, you have to really go outside. And as much as, it's really complicated to figure out which is the things that are worth it and which are not, and how to get them safely, both for yourself and both for the people you're documenting. So it's been a challenge, and it's kind of like a constant challenge of trying to figure out not only how much risk you want to take for yourself, but how much risk you are willing to put other people at. And there's no one clear answer. It's kind of, I think the one thing that you kind of have to say to yourself or to your, just to make it through it, is that, this has to be worth it. This has to be important work that makes a difference and that creates a new understanding, and if you can have the work do that, then you can find ways to do it safely. If you can't, if you're doing it for yourself or you're doing it for the wrong reasons, then it's probably not going to be worth it to put yourself and others at risk. So yeah, it's been challenging, as I'm sure it's been for so many other journalists here.
Okay, so I can, regarding the two questions that are put forth to me and Ran. So regarding approaching like patients and healthcare workers, indeed, I would say it is a challenge. So first of all, I could share about on the patient side, because the authorities have been really protecting the identities of those patients. So, of course, they won't reveal the context to the media. And we have also tried to approach public hospitals to see if they could arrange interviews for us to we could speak to those patients as well. But also, they also appear to be quite reluctant because of the reason that I have just mentioned. So we need to use other ways, to look for those patients. I could share an experience from my colleague. So she was actually looking for the 80-year-old man who was said to be the patient zero on the Princess Diamond cruise ship. So we did not have that old man's contact, but then we knew where he lived because the Department of Health actually would reveal where the patient lived. Not the exact address, but like the rough address, like which estate, which building this patient lived in, but not the floor, not the room number. So my colleague, what she did was she actually waited downstairs in the building, like to wait for hours until she saw that patient. So of course, how did she know? How did that patient apply? Well, actually, it was a small follow-up on, because another media has reported about this patient story as well. So, but then we did not have this patient's contact. So that's the way we did. We just waited downstairs the building until, and then my colleague, she was very lucky, and then she managed to see the patient at the end and managed to do the interview. And I think she ran a focus piece, a really long piece on that patient, sharing why he did not think that he was patient zero, and also looped in voices of other doctors and experts as well. And when you're talking about healthcare workers, indeed, it is also difficult because, we have healthcare workers unions. They're often outspoken, they often speak to the media, but sometimes they're not always the one who work in dirty team. Dirty team are referring to healthcare workers who are dealing with suspected or confirmed COVID-19 patients. So in this case, there are two ways. I would need to ask those union leaders to help me to help me to get in touch with those frontline healthcare workers, see if we speak to them. Another way is maybe I need to use my own personal network, perhaps my secondary schoolmates or university schoolmates to ask them if they know someone who could talk to me. But still, there's a problem that oftentimes they cannot go on record because their interview was not approved by the authorities. So in my previous piece on talking to the dirty team healthcare workers, I could only keep them anonymous in my stories, but still I could manage to tell the stories on the hardships, on the sufferings, or the feeling of isolation when they're working in their team. So there's a ways that you have to, go around a bit the corners, maybe not following what you usually do when dealing with other sorts of interviews, but still there is a way. But it's just you need to spend a bit more effort to do so.
Yeah, Rand, do you have anything to add to that?
Yeah, I think the remote interview, we call it remote interview, maybe it's a good way for the reporter to access both to the patients and the medical doctors, The remote interview, you understand that? I'm not sure, I give you an example for the story on AFN, the doctor in Wuhan Central Hospital. So our reporter, who is alumni of this university, Hong Kong Baptist University, the reporter access AFN, he tried to contact the different doctors and nurses in the same hospital through their Weibo account. He found dozens of Weibo account, individual Weibo account in the same hospital. The owner of the account are nurses and doctors. So he have touched with each of the account, and some of them responded to him. So finally, he found AFN and some other nurses and doctors. He finally had access to AFN through the WeChat. The chat from through WeChat, the chat for a week long. The interview, the remote interview, is a 1 week interview to AFN and some other colleagues of AFN in the same hospital. So he found the fact that many medical staffs in the same hospital are infected, and then he do the story. So it is a special access, it's an advantage in the era of social media and the era of internet. We cannot imagine that. He do the story only from Beijing to Wuhan through the WeChat, and telephone, everything. He found the different sources in the same hospital through Weibo account. I think it's a special way. I did that.
Great, thank you. We're running out of time. I ask one last question. We can have a brief discussion, and then we'll have to end the webinar. The final question is from one of our students, Lu Xiaoqian, and she says, we've been seeing journalists trying all kinds of ways to report COVID-19 in the last few months. Some of them are even reporting on themselves. So our question is does participatory journalism, does it conflict with journalists, with professionalism, and that journalists are involved in the stories that they're reporting? And I think we can also kind of broaden that question a little bit to what is the value of participatory journalism or citizen journalism as well. So I don't know who wants to start off with that one. So what do you think about journalists covering themselves during this particular story?
I can talk a bit. I think that, the question of, is it ethical? I think that in this situation, I think the whole world, everyone in the world is affected by this. I think that's something that we have not seen before. So ethically, everyone is participating in one way or another, right? And I think that hearing different perspectives safely requires you to kind of get creative. I think part of the creativity is, how do you film people? Can you film them at home? Can you film them? No, so the best way to kind of do it is for people to kind of tell their stories. For me, as someone that's interested in a story of someone else somewhere else in the world, what better way and with what better means do we have than to kind of have people film it themselves? Ethically, the question of, is it, are they intervening on their own story? I think ethically we are all part of the story in one way or another. So I'm not sure how, I don't see how it would be a conflict of interest in that sense, depending on how it was handled and how it was sent out and kind of distributed.
Okay, anybody else want to jump in, or Elizabeth or Ran?
So I'm not sure if I get it clear when you talk about participatory journalism. Does it mean like having like our readers to contribute news materials, or we just reporting what is happening on us?
I think what the student is wanting to know is normally a journalist would not be part of the story. So when you see a journalist doing a story about their own quarantine, she's asking if there is a conflict of interest, and what do you think about being part of the story that you're trying to cover?
I think it is really fair to do so, and that's actually what we have been doing as well. If you could, and we have run quite a few stories about ourselves. If you could recall, my colleague Emily Zhang, she actually wrote a piece about how she escaped from the UK back to Hong Kong, and she actually wrote a really an excellent first-person account on the whole process, from the time when she boarded the plane and saw all the passengers that were in protective gears, and the moment when she reached the airport, she was given that blue bracelets, and then when she got back home. I think there's something interesting for readers to read, and for the first person account that really gives you another angle to look into a story. And also by the time when our newsroom reported the first COVID-19 case, and then our newsroom was forced to shut down, actually we ran story on that as well. And because the impact of this COVID-19 epidemic is just so huge. I mean, it's the same as what Ben said, it's just inevitable that everyone could be affected. And for us, we journalists also live in this community with the others as well. So I think it is fair to report, to cover stories about ourselves as well.
Great. Okay, well, we have so many good questions. I'm sorry we couldn't get to all of them. We're gonna go ahead and end the Q&A there. And Raymond, maybe you can say a few words before we leave.
Okay, thank you, Robin, and the panelists. I'm afraid that's the end of today's webinar. And so thank you all for your participation, and especially the panelists. And last, I'd like to wish you all a very happy and healthy Easter holidays, maybe starting from a Good Friday. Thank you all. Bye-bye for now.
Thank you.
Thanks.
Thank you. Goodbye.
Bye.
Thank you for coming, everyone. Really appreciate it. Bye-bye.
Bye-bye.